Welcome to the sixth and final video in the Connect series. I'm Julie Saunders, Director of Clinical Research at St Bartholomew's Hospital in London, UK, and Clinical Professor of Cardiovascular Nursing at the William Harvey Research Institute, Queen Mary University of London. I'm also a co-founder of Connect, which is the Cardiac Surgery International Nursing and Allied Profession Research Network, and forms the focus of this video. So Connect members have presented 5 great and informative videos exploring the best evidence and future research and practice needs of some of the most important areas of cardiac surgery care. This final video of the series will explore the role that Connect has in connecting evidence and practice around the world. So first, let me introduce you to Connect and the why and how Connect was established. So as shown here, nurses and allied professionals make up the majority of the healthcare workforce, but it is well known that there is a global nursing and allied profession workforce shortage. Since only 0.1 to 0.2% of the nursing workforce have a PhD, there is recognition that there is a need to increase nursing and allied profession research capacity internationally. This is especially true in cardiovascular surgery, where there are very few nursing and allied profession researchers around the world. And this inevitably has an impact on patient outcomes. Evidence indicates that doctorally prepared nurses can raise practice standards and are necessary to provide safe and high quality care. Therefore, this lack of capacity impacts the advancement of the profession in the continued development of the evidence base and in the implementation in practice to improve patient outcomes and experience. Certainly, it is also recognised that doctorally trained nurses in low to middle income countries have considerable value in increasing nursing-led services and therefore increasing access to healthcare where it is currently limited. So the 4 of us from Canada, Australia, the UK and the USA came together, initially to work and collaborate together as we knew very few other professors of nursing in the field. I obtained a travel fellowship from the Society of Cardiothoracic Surgery of Great Britain and Ireland and travelled to Canada to meet Professor Fredericks. We arranged a package of work to undertake with Professor Wynne and Dr. Martorella, and through collaborating and delivering this work, which included a 6-paper series on the international perspectives of cardiac surgery nursing for the British Journal of Cardiac Nursing, developing some projects and providing some PhD student support, we realised how effective and valuable it was working together. Therefore, we launched Connect in 2021 to widen the network beyond just us so that we could connect and work with cardiac surgery nursing and allied professional colleagues all over the world. So the vision of Connect is to be a global community of nursing and allied profession cardiac surgery researchers. And through Connect, we will foster and support international cardiac surgery research to address global cardiac surgery challenges. So we will achieve this by growing an international network of nursing and allied professional, clinical academic and academic cardiac surgery researchers. We will provide a virtual research environment to identify opportunities for mentorship, support and research collaborations. And also by developing new interventions to prevent, identify, manage and reduce complications related to all stages of cardiac surgery. We have an email, Twitter account and a website that details all about us, our members and our collaborative groups. We also have our webinars and outputs on there to date. And in the last 2 years, we've welcomed members from around the world, including Australia, Brazil, Canada, Denmark, Ireland, Norway, Sweden and the UK. And we've also been collectively productive. And since our launch in June 2021 at the ESC ACNAP Euro Heart Care Congress, we have delivered 2 webinars, established a clinical academic and research group, have presented at a number of national and international conferences, and set up a mentorship programme. We've also published several papers and have a number of projects and collaborations underway. So how does Connect plan to contribute to shaping the evidence and cardiovascular nursing and allied profession practice of the future? Well, we aim to continue to work in areas of current importance in both practice and research. In this series, we've tackled a number of important issues, both in practice and research need, including sex inequalities, post-operative pain, surgical site infection, patient perspectives, and supporting research in practice for nurses and allied professionals. However, overall we see the work of CTSNet broadly addressing three main aims. Firstly, we want to address research priorities. So we want to collaborate on research that addresses key priority areas, perhaps as identified by ERAS, national priorities, research that's been identified as being important for patients and their families, and also exploring general research priorities in terms of inequalities, mental health, genetics and workforce. We also plan to increase our support for clinical academic development and lobbying for clinical academic and academic roles within the speciality in order to increase nursing and allied professional research capacity around the world. And one of our key aims is to support research and best evidence use in practice by supporting research in practice initiatives and perhaps offering masterclasses to our colleagues internationally. So how will CTSNet continue to deliver and progress this agenda? So as I've explained, we plan to undertake collaborative research, and our current areas of work include patient-reported outcomes, pain management and discharge care. Our mentorship and scholarly engagement programme supports our nursing and allied profession clinical academic development aims, but we also plan to increase that and provide more opportunities and more international scholarly visits over time. Due to the vast clinical and research expertise within CTSNet, we aim to continue to work with international associations, particularly to increase awareness of CTSNet and the work we're doing, but also they provide opportunities for evidence dissemination within the speciality. And as we aim to grow our education and research support portfolio, we plan to progress our work with industry and other colleagues around the world to be able to identify and deliver activities that will support best practice and research development. We have some masterclasses in development, and please refer to the CTSNet website in coming months relating to their release. So in summary, there is a paucity of nursing and allied profession clinical academics around the world, but particularly in cardiovascular surgery. This undoubtedly affects patient outcomes in our ability to deliver and implement best evidence, and also for the progression of the profession. Therefore, CTSNet has aimed to address some of these limitations by creating a virtual international network to aid collaboration on areas of research priority, to support building nursing and allied profession clinical academic capacity in cardiovascular care, and to provide expertise in delivering improved evidence-based practice internationally. So it's my pleasure to close this series of 6 videos delivered by CTSNet members, which are focused on delivering the current evidence base of several important issues affecting patient recovery from cardiovascular surgery. It's also highlighted the importance of embedding research in nursing and allied professional practice and the need to increase nursing and allied professional research capacity and capability in cardiovascular surgery. So CTSNet, an international network of cardiovascular nursing and allied professional researchers, has a key role to play in using their collective expertise to deliver research and support evidence-based practice around the world, both to enhance patient outcomes from and the experience of patients of their cardiac surgery. Thank you for your time in viewing this series, and to CTSNet for the opportunity to develop the series to highlight nursing and allied professional contributions to cardiac surgery research and the development of evidence-based practice. We would be delighted for you to get in touch if you are a nurse or allied professional working in cardiac surgery research or would like to collaborate or support CTSNet's work. We look forward to hearing from you. Thank you once again.